New data suggests nearly half of all new coronavirus infections in the United Kingdom may be a new variant. There are more than 21,000 people in hospital this festive season as health authorities work to stop the spread.
We wish you a Merry Christmas. We wish you a Merry Christmas.
Up and down the country, Christmas is different.
What are we going to do with these?
For the people staying at home,
hi, Merry Christmas, everyone.
And those planning a quiet Christmas.
Merry Christmas!
In Tier 2 Oxfordshire, Tier 4 awaits.
Chocolate or icing? Chocolate.
Tomorrow, people can still form a Christmas bubble. On Boxing Day, they'll be told to stay at home.
Any English tulip today? £3 a bunch, fresh.
And Richard's flower shop will have to stay closed.
We bought a lot of tulip bulbs in to grow for Christmas, hoping there would be no lockdown. This will cause problems. We've still got them left to sell, so what else do we do?
But as the government tries to save lives first, the pandemic curve is climbing. And the number of people testing positive in England rose by 58%, according to the latest test and trace figures. Separate statistics show that on the week starting the 12th of December, around 1 in 85 had COVID in England, compared to 1 in 95 the previous week. In Northern Ireland, it was 1 in 180. In Scotland, 1 in 140. In Wales, there was a steep rise, with 1 in 60 estimated to have COVID-19.
I think we've got more inpatients now than at the peak of the first wave, and that shows no sign of letting up at all, and actually the case rate around here is rising. This is a degree of busyness that none of us have ever seen before, really, and, you know, what with the hospital getting increasingly full of patients with COVID, you know, it's only a matter of time, really, before we go over our capacity.
Right now we see still...
And with warnings a new variant could account for half of UK cases, Christmas won't be all that's lost to COVID.
These restrictions were implemented so late. We cannot do really anything for the New Year's. We will see a peak of infections then. Hopefully the latest March will help us to just start going back to something relatively normal.
The rise in cases is partly down to more testing, but even a week ago, this is a Christmas few expected, and it's what happens beyond December that matters now.